Become the latest high-profile Aussie to open up about her long-term battle with endometriosis.
She joins the likes of Olympic gold medalist Emily Seebohm and former Yellow Wiggle Emma Watkins, who have spoken out in recent years, shining further light on an illness that affects at least 1 in 9 Australian women. Well, gynaecologist and fertility specialist Dr. Manny Mangat joins us now to discuss. Doctor, good morning to you, and thanks for coming in.
Thanks for having me.
Could you explain for us, firstly, what is endometriosis?
Endometriosis is a condition where the lining of the uterus grows outside the pelvis and can also grow around other organs. Now, I'm wearing yellow today because it's Endometriosis Awareness Month.
So tell us about why we're hearing about these diagnoses, not just from the likes of Bindi Irwin or celebrities, but from other people more and more.
So I think over the last 5 years there's been more education and awareness around the condition, and organisations like Endometriosis Australia, web pages like Endozone and Image Endo offer great resources for patients. It's given women a voice to advocate for their condition and to better understand the symptoms. I also think the very important government project, so the Endometriosis National Action Plan, provided much needed funding for research as well as better imaging, and therefore leading to quicker diagnosis and better clinical treatment for the condition.
Can I ask, just as a novice, as a guy in the situation here who's raising a daughter too, are there signs that we haven't known before, that people at home may not recognise, of what endo is?
Endometriosis is one of those really difficult conditions, hence why misconceptions surrounding the condition. It's been underdiagnosed, and the delay in diagnosis on average is 6.5 years. And the reason for this is because symptoms are very variable. We now know that 1 in 9 women suffer from endometriosis, and the symptoms can be variable from no symptoms at all for some people, ranging to debilitating pain, irregular bleeding, but also non-specific symptoms like nausea and fatigue. And this sometimes makes diagnosis quite difficult. Endometriosis also affects fertility for some people.
Oh, it's awful to think, you know, that Bindi, like so many other women, has been suffering with this in silence. And clearly, you know, she's explained that she was carrying a lot of pain as a result of it as well. What is your advice to anyone who does think that they may have endometriosis? Where should they go? Who should they speak to?
So if a woman has any symptoms suggesting it could be endometriosis, or they've got painful periods and difficulty conceiving without any other symptoms, I think they should still discuss this with a doctor or a gynaecologist, fertility specialist. So it is important that we organise high-quality imaging, because these days that can help diagnose the problem even before surgery, and then individualise their management, because it's very important to not only treat pain and quality of life, but take it in consideration with their fertility situation, as well as their egg reserve and whether they need to freeze eggs or embryos prior to surgery.
We're looking at the picture of Bindi there in the hospital. We do hope that she gets better quickly, but is surgery the only option here for endo?
Not at all. So better quality imaging has provided a diagnosis without surgery. Surgery has to be taken in the whole situation in consideration. So if patients have debilitating pain and can't function, or having difficulty conceiving because there's been scarring or change to their reproductive organs and tubes, then yes, surgery can help that. Surgery can help natural conception, but there's also medication that can help control that, and sometimes we need to look at their fertility situation before embarking on surgery, because chocolate cysts in the ovaries can reduce egg reserve.
Okay. Dr. Manny Mangat, great to get your insights.
Thanks,
Thank you so much for joining us.
Thank you very much.
See you soon. Stay with us. Straight ahead, commuter chaos.